So very good morning. Today we are going to discuss about diuretics. So I have come up with some learning outcomes, that targets that we have to complete, that 4 targets within next 1 hour. So at the end of this live lecture, you will be able to define diuretics. You will be able to classify the diuretics agents depending on the chemical structures. After that, you will be able to explain the pharmaceutical importance of diuretics. And at last, you will be able to draw the chemical structures of hydrochlorothiazide, furosemide, and mannitol. One more structure is that urea, but I am not going to discuss about the structure of urea because it is very easy structures. You have to do by yourself. So today, we are having these 4 objectives in front of us. And at the end of this lecture, you will be able to define the diuretics, classify diuretics. You will be able to explain the pharmaceutical importance of diuretics, and you will be able to draw the chemical structures of hydrochlorothiazide, furosemide, and mannitol. Okay, let's start with the definitions. So diuretics are the drugs that increases the amount of urine produced by the kidney. Any chemical substances, any pharmaceutical substances which has capability to increase the amount of urine formation by kidney, that agents are called as diuretics. Or in other words, it is called as any substance that promotes the diuresis. Means any substance which are having capability to produce a diuresis effect. What I am saying? Diuresis effect. What is mean by diuresis? Diuresis is nothing but the increased production of urine as that of normal. That process is called as diuresis. Dear students, whenever there is increase in the production, increase in formation of urine than that of normal, that time that process is called as diuresis. And the substance or the drugs which having capability to produce the diuresis are called as diuretics. So I think these definitions are very clear for you peoples. That is the drugs that increase the amount of urine produced or amount of urine formations by the kidney are called as diuretics. So let's see the classifications. And sometimes you will find out in some of the books the another name of diuretics is water pills. Another name of diuretics is water pills. So this is the chemical classification of diuretics. First class is the thiazide diuretics, having the examples hydrochlorothiazide, chlorothiazides, benzothiazides. Second class is loop diuretics, or it is also called as high ceiling diuretics. For example, furosemide, bumetanides, ethacrynic acid, and torsemide. Third class is the carbonic anhydrase inhibitors. For example, acetazolamides or methazolamides. These drugs are also useful in the treatment of glaucoma. For example, acetazolamides, it is useful in the treatment of glaucoma. The glaucoma is the disease related to your eye, related to your eyes. Intraocular pressure increase, that condition is called as glaucoma. Now for the treatment of glaucoma, the acetazolamide is used. Then the fourth class is potassium sparing diuretics. Potassium sparing diuretics. In that it has 2 subclasses. First is aldosterone antagonist. Another subclass is sodium channel blockers. So these potassium sparing diuretics are two class. First one is aldosterone antagonist, example is spironolactones, and second class is sodium channel blockers, examples is triamytrine, amylorides. Triamytrines and amylorides are the examples of potassium sparing diuretics. Next class is osmotic diuretics. For example, mannitol, urea, glycerin also useful as a diuretics, and methylxanthines class. Example is aminophylline. Dear students, you have observed that if you are taken the more amount of tea or coffee, isn't it? That is the hot drinks which are generally available in our home, coffee or tea, which is containing the caffeine, and caffeine is nothing but the methylxanthine derivative. If you have the excess amount or the more amount of that particular hot drinks such as tea or coffee, that times you have experienced that the frequency of urination get increased or the amount of urine formation get increased. That effect is called as the diuretics or diuresis. That effect is called as diuresis. I think you have experienced that particular things. Suppose one day you have a more amount of tea or more amount of coffee. That time you have experienced that there is increase in the frequency of urinations or increase in the formation of urines. And that effect is called as diuresis. And the drug which cause the diuresis are called as diuretics. So those drugs names are highlighted by using the blue color. Their structures is for your study purpose. Means you have to study these four structures. That is hydrochlorothiazide, furosemide, mannitols, and urea. So as I told earlier that while writing the classification, always mention the heterocyclic ring or functional group present in that particular drug. So it will be very easy to remember the chemical structure of drug. Okay. So if you want to remember the structure of hydrochlorothiazide, you must know which heterocyclic ring present in the structure of hydrochlorothiazide, and name of that particular ring is benzothiadiazine. This ring is present in the structure of hydrochlorothiazide. That is benzothiadiazine is the name of heterocyclic ring present in hydrochlorothiazide. Second is the furosemide, and it contains the furon. First three letter is very useful for this furosemide. See here, FUR, and furon also always start with FUR. So ring present in the loop diuretics or high sealing diuretics, example is furosemide, is furon. So hydrochlorothiazide containing benzothiadiazine ring and furosemide containing furon ring. Okay. So always remember, while writing the classification in your notebook, always mention the heterocyclic ring present in the structure of your drug. So dear students, here is pause point or reflection quiz for you people. Quiz is on your screen. That is, you have to give the name of heterocyclic ring present in the structure of furosemide and hydrochlorothiazide. I will wait for 1 minute for your reply in chat box, and then I will proceed further. You have to name the heterocyclic ring present in furosemide and hydrochlorothiazide. Yes, anyone reply? Nishant Patil. Very good. Very good. So correct answer is furosemide contain furon ring, and the hydrochlorothiazide contains benzothiazide ring. Okay, check your answer whether your answer is correct or not. Okay, benzothiazide, benzothiazide. So furosemide containing which ring? Furon. Hydrochlorothiazide containing benzothiazide ring. So let's see the first diuretics, that is thiazide diuretics. So on your right hand sides, I have keep the diagram, or you can say the figure of the nephron. So thiazide diuretics are act on the distal convoluted tubule. So this is the distal convoluted tubule. So this is the distal convoluted tubule. So this thiazide diuretics acts on DCT, distal convoluted tubules. It inhibits the sodium chloride transporter in the distal tubule. If you know the process of urine formation, second step is what? Reabsorption. In that steps, the maximum amount of water and essential ions are get reabsorbed into the bloods, isn't it? Means from filtrate to blood, and then remaining filtrates are goes into the collecting duct, and through collecting ducts it will goes to the urinary bladders, and it is excreted as a urine. But the name of our today's chapter is what? Diuretics. And diuretics means what? Increased production of urine, increasing formation of urine. So first class is thiazide diuretics, which is act on distal convoluted tubules, where it is inhibit the sodium chloride transported in distal tubule. If you're not able to remember the sodium chloride transporter, you can just remember the thiazide diuretics is responsible for inhibit the reabsorption process of sodium ions. Reabsorption of sodium ions. So second step of urine formation is reabsorption. Means whatever the essential ions and waters are lost in a glomerular filtration steps, they are get reabsorbed into the blood. So they get re-entry into the your blood. शरीरामध्ये ते परत जातात. परंतु थायझाइड डायरोटिक्स जर तुम्ही घेतले तर थायझाइड डायरोटिक्स काय करतात की सोडियमचं रिॲब्सॉर्प्शन इनहिबिट करतात. Because of that, the more amount of sodium is remains in filtrate, and because of sodium is remains in filtrate, it will increase the retention of water in filtrate also, in order to maintain the osmolarity, in order to maintain the ionic concentration of the body fluids. विद्यार्थी मित्रांनो, हे लक्षात घ्या, बॉडी फ्लुइड मध्ये म्हणजे इंट्रासेल्युलर आणि एक्स्ट्रा सेल्युलर जे काही फ्लुइड असतं त्याच्यामध्ये आयोनिक कॉन्सन्ट्रेशन हे आयसोटोनिक असतं. आयसोटोनिक मीन्स व्हॉट? इट इज इक्वल कॉन्सन्ट्रेशन, and that is called as isotonicity, isn't it? So if sodium is remains in filtrate, in order to maintain the concentration, waters also remains in filtrate. So through this distal convoluted tubule, it will get entry into the collecting duct, and through this collecting duct, it will get entry into the urinary bladders and excreted as urine. So by inhibition of sodium, I will repeat, by inhibition of reabsorption of sodium by thiazide diuretics, it increases or it inhibit the reabsorption of water also. So this leads to retention of water in filtrate, and which is excreted as urine. So ultimately what happens? The 80% portions which has reabsorbed during the phase 2, it get blocked, and that remains as it is in the filtrate, and filtrate finally goes into the collecting duct, and then go to the urinary bladder, and through urethra it is get excreted as a urine. So ultimately what happens? The amount of urine get increased. Amount of urine formation get increased. That's why that drug is called as diuretics. लक्षात घ्या विद्यार्थी मित्रांनो, डायरोटिक्स म्हणजे काय की जे ड्रग युरिन फॉर्मेशन प्रोसेस फास्ट करतात आणि अमाऊंट ऑफ युरिनला इन्क्रीज करतात, त्या ड्रगला डायरोटिक्स असे म्हणतात. पहिला क्लास आपण बघतोय थायाझाइड डायरोटिक्स. ह्या क्लासमध्ये काय होतं? दिस थायाझाइड डायरोटिक्स इनिबिट द रिअब्सॉर्प्शन, मीन्स these drugs are act on second step of your urine formation. It is act on DCT, that is distal convoluted tubule. It is distal convoluted tubule. Okay, and in distal convoluted tubule, it inhibit the reabsorption of sodium ions. It inhibits reabsorption of sodium ions. Ultimately, it will leads to the retention of more amount of water. So both sodium and water retain in urine, or you can say retain in filtrate, which is excreted as a urine. Okay, I think this is a very clear idea about the thiazide diuretics. Now let's see the chemical structure of hydrochlorothiazide. As we have discussed, it containing it is also called as benzothiadiazide derivatives. This thiazide is also called as benzothiazide derivative, which contain the benzene ring. So this is the benzene ring, and this is another heterocyclic ring. So can you give the name of this heterocyclic ring which I have underlined? Yes, I'm waiting for your answer in chat box. Just try to give the name of this compound. For your easy understanding purpose, I will numbering from the sulfur, because sulfur is a more prior. Then go to the second heterocycle atom, 3, 4, 5, and 6. So 6-member heterocyclic ring, 6-member heterocyclic ring. So which suffix is used, which prefix is used? Shubhangi Gomte, very good beta. So you have forgot how to name the heterocycle ring by combining the suffix, prefix, ring size, whether it is saturated or unsaturated. So it is 6-member ring. So I think INE suffix is used. For sulfur, you have to use thia. Then nitrogen is 2, so di for 2 nitrogen. Aza plus INE, so thiadiazine is the name of this ring, and mention the position 1, 2, and 4. 1, 2, 4. Thiadiazine is the name of this ring. One, two, four, thiadiazine is the name of this compound. So benzothiazide containing benzene ring and 1,2,4 thiadiazine ring. So once they get fused, the ring looks like this. The name of this ring is 1,2,4 benzothiadiazine. So benzene fused with thiazide, it will forms benzothiazide. Okay, you have to give the number 1 2 4. So 1 2 3 4 5 6 7 and 8. So likewise you have to numbering the benzothiazide. So fusion of benzene with thiazide, it will use benzothiazide. But if you see the example of hydrochlorothiazide of which class? Thiazide or benzothiazide. So it is not azine, not INE. Okay. What is it containing? IDE. So it must containing dioxide. Azide means double bond O. So you have to give two double bond O to this sulfur atom. So name, actually this is the correct structure of benzothiazide. This is the structure of benzothiazide. लक्षात घ्या विद्यार्थी मित्रांनो, आता ही सर्वात सुरुवातीला आपण बघतो हे आज पहिल्यांदा, त्यामुळे तुम्हाला थोडं अवघड जाईल, परंतु जसं जसं तुम्हाला बघण्याची प्रॅक्टिस होईल तसं तसं तुम्हाला सोपं जाईल. आधी काय बघायचं आपण? बेन्झोथायाझाइड इज अ कॉम्बिनेशन ऑफ बेन्झीन and 1,2,4 thiazide. So INE means what? 6. INE means what? 6 member heterocyclic ring. Okay. Then thia means sulfur, di means 2, and aza means nitrogen. So position is given here 1, 2, 4. So 2 number nitrogen, 4 number nitrogen. So this is thiazide ring. So you have to fuse benzene with thiazide ring. So it will forms benzothiazide ring. And if you see here is azide, so you have to add dioxide. So double bond O at sulfur. So sulfur has 6 valencies or 2 valencies. So here 6 valencies there. So you have to add the 2 oxygen atom on sulfur. Okay. So it is very easy to convert the benzothiazide to benzothiazide. लक्षात घ्या, जर तुम्हाला बेन्झोथायडायझिनचं जर स्ट्रक्चर येत असेल तर तुम्हाला बेन्झोथायझाइडचं स्ट्रक्चर खूप चांगल्या प्रकारे लक्षात येईल किंवा लक्षात राहण्यासाठी मदत होईल. ओके. सो इफ यू नो द स्ट्रक्चर ऑफ बेन्झोथायडायझिन, it will be very easy to convert the structure into benzothiazide. If you observe the difference between these two structures, here is S double bond O, and here is only S. So this is the only difference. Still, this is not the structure of hydrochlorothiazide. This is not structure of hydrochlorothiazide. We have just learned the basic heterocyclic ring present in hydrochlorothiazide, and ring is benzothiazide. Okay, diazide. So you have to give double bond O on sulfur. Now we will see how to remember the structure of hydrochlorothiazide, or how to draw the structure of hydrochlorothiazide. So now you have come to know that hydrochlorothiazides having the basic structure of benzothiazide. So this is the structure of benzothiazide, and here this is the structure of hydrochlorothiazide. This is the structure of hydrochlorothiazide. Okay. So if you draw the structure of this hydrochlorothiazide and benzothiazide, then you have to point out the difference. What difference you can able to visualize? लक्षात घ्या विद्यार्थी मित्रांनो, जर आपल्याला स्ट्रक्चर जास्त वेळा लिहून पाठ करण्यापेक्षा जर ते लक्षात ठेवून जर अभ्यास केला तर आपल्याला खूप चांगल्या प्रकारे आणि खूप जास्त दिवस ते लक्षात राहील. आपण काय मेथड वापरणार आहे ह्या स्ट्रक्चर लक्षात ठेवण्याकरता? आपण सुरुवातीला त्याच्यामध्ये कुठली हेट्रोसायक्लिक रिंग आहे ती आपण ड्रॉ करणार आहे. त्याच्या समोर आपण ड्रगचं स्ट्रक्चर ड्रॉ करणार आहोत आणि मग आपण याचं ऑब्झर्वेशन करणार आहोत. ऑब्झर्वेशन मीन्स what is the difference between the structure of heterocyclic and structure of drug? So can anyone point out any difference between these two structures? So what are the additional groups are added into the structure of hydrochlorothiazide? कुठले कुठले ॲडिशनल ग्रुप्स तुम्हाला दिसतात बेन्झोथायाझाइडच्या स्ट्रक्चरवर, जेणेकरून ते स्ट्रक्चर झालं हायड्रोक्लोरथायाझाइडचं? येस येस, रिप्लाय फास्ट. क्लोरीन पोझिशन नंबर काय मोनिका क्लोरीनची? Yes, it is on 7th position. Another functional group or another group? Okay, name of this group is sulfonamide. It is written like that also. Okay, SO2 NH2. It is on left side, that's why it is written reversely. Okay, so this group is called as sulfonamide. Sulfonamide group is at 6th position. So there are only two difference. Yes, means at 6th position and at 7th position. Is there any difference between these two structure now? Yes, I'm waiting for your reply. Is there any another difference if you observed between this structure? Yes, very good. 4 hydro, very good. First string is fully saturated, very nice. So here if you see, in case of benzothiazide, it is having unsaturation at number 3 and 4 or between 3 and 4, but here there is no double bond. That's why that name starts with hydro, because it does not having double bond between the 3 and 4. That's why the name of this drug is start with hydro. So now you are able to observe the structure of basic heterocyclic ring and the structure of hydrochlorothiazide. On the basis of observations, you have point out the three difference. What difference is what? Addition of chlorine group at 7th position, addition of sulfamido group at 6th position, and there is no double bond between 3 and 4 number of atoms. So by remembering this difference, you can able to remember the structure of these drugs. But still, I can give you another method by which you can able to remember the structure of this hydrochlorothiazide. Okay, so what is this method? We have to just break down the word hydrochlorothiazide into first letter hydro. So hydro means what? There is no double bond between 3 and 4 carbon atom. That's why we have used the prefix hydro. If you have remember that we have seen the what? We have seen the IUPAC nomenclature rules of common heterocyclic ring. That time we have studied that the hydro prefix is used if there is saturation. Okay, so hydro stands for what? So this is just a logic, or otherwise you will take it considered as hydro means dihydro. It is not like that. Okay, it is just a logic. So hydro we are taken from the name itself of drug, hydro. So it means 3 and 4 dihydro. Okay, next word is what? Chlor. Next word is what? Chlor. Chlor means chlorine at 7th position. And then what is remaining? Thiazide. So thiazide means what? So benzothiazide and sulfonamide at 6th position. So already we have seen how to draw the structure of benzothiazide. Okay, you have to just attach the 6th number position sulfonamide. So everything is added in your structure. So if you remember only these things, okay, you can able to remember the structure of hydrochlorothiazide. It is a very simple way to remember the structure of hydrochlorothiazide. This is very simple way to remember the structure of hydrochlorothiazide. Are you getting? It is very simple to draw the structure of hydrochlorothiazide. First, you have to draw the benzothiazide. Okay. For thiazide rings, you have to draw the first benzene. Okay. And then thiazide. Mix the benzene with thiazide and then add double bond O here or add sulfur, 2 double bond O. So it becomes benzothiazide. Then go with the name hydro, means 3,4 dihydro. Chloro means 7 number chlorine you have to add, and sulfonamide at 6th position. So it will be very easy to remember the structure of hydrochlorothiazide. So here is the IUPAC name of hydrochlorothiazide. Okay. So 7 chloro, 1 dioxo. So double bond O is remembered as oxo because sulfonamide is the principal functional group. 1, 2, 3, 4 tetrahydro. Okay. This one number also considered for hydrogen because it's not containing the double bond. 1, 2, 3, 4 tetrahydro. 1, 2, 4 benzothiazide 6 sulfonamide. 1, 2, 4 benzo diazine 6 sulfonamide is the name of or IUPAC name of this hydrochlorothiazide structure. Okay, so we will move further. I think you have taken the structure in your notebook. So what are the properties of hydrochlorothiazide? So it is white crystalline powder which is insoluble in water, but it is soluble in alkali hydroxide. It is a white crystalline powder, insoluble in water, but soluble in alkali hydroxide. What are the uses? It is used as diuretics. It is used as antihypertensive agents. And another use is it is useful in the treatment of edema diseases or all types of the edema. Okay. So next class of diuretics is loop diuretics, or it is called as high ceiling diuretics. If you able to observe the diagram of nephron, here if you see here loop of the nephron, so this is descending loop and this is ascending loop, followed by this is distal convoluted tubule attached to collecting duct. Okay, so loop diuretics means what? The agents which are act on loops, that is loop of Henle. Basically these drugs are act on thick ascending limb or ascending loop. These loop diuretics act on thick ascending limb. Here they will inhibit the reabsorption of sodium. Inhibit the reabsorption of sodium. So these blood capillaries will not able to reabsorb the sodium into blood circulation again. So filtrate goes like that. Okay. So sodiums are not get reabsorbed into the blood vessels again or blood flow. Why? Because of action of loop diuretics. So they inhibit the sodium potassium chloride co-transporter. Co-transporter means what? Exchange of sodium with chloride and potassium. So if you unable to remember these things, you can just remember these drugs also inhibit the reabsorption of sodium. Because of stop the reabsorption of sodium, water also get retained in the filtrate. So amount of sodium and waters are remains as it is in filtrate. So ultimately their reabsorption is inhibited, so urine production get more and more. That's why that drugs called as diuretics. ज्याप्रमाणे थायाझाईड डायरोटिक्स ऍक्ट होतात त्याचप्रमाणे लूप ऍक्ट होतात. फक्त थायाझाईड ऍक्ट कुठे झाले होते तुमचे डिस्टल कॉन्व्हिलेटेड टिब्युलर ऍक्ट झाले होते. आता लूप डायरोटिक्स कुठे ऍक्ट झाले लूप ऑफ हेनले असेंडिंग लूप ऑफ हेनलेवर ऍक्ट झाले. बट बोथ ड्रग्स आर एबल टू इनहिबिट द reabsorption of both drugs are inhibit the reabsorption of sodium. So more the sodium infiltrate, so water remains as it is, their reabsorption get inhibit. जर सोडियम जर फिल्ट्रेट मधून हो की नाही म्हणजे ग्लोमेरुलस फिल्ट्रेट मधून ब्लड सर्क्युलेशन मध्ये जर परत गेला नाही तर वॉटर पण जात नाही. लक्षात सोडियम ब्लॉक केला तर वॉटर पण ब्लॉक झालं. त्यामुळे काय झालं ते फिल्ट्रेट मध्ये आहे तसेच राहिले. नॉर्मल युरिन फॉर्मेशन प्रोसेस मध्ये काय होतं पहिली स्टेप फिल्ट्रेशन असते, दुसरी स्टेप रिॲब्सॉर्प्शन असते की ज्याच्यामध्ये 80% वॉटर 80% आयन्स 80% न्यूट्रिएंट्स आर गेट रिॲब्सॉर्ब. रिॲब्सॉर्ब मीन्स व्हॉट री एंट्री इनटू द ब्लड सर्क्युलेशन. पुन्हा ते शरीरामध्ये एंटर करतात. फिल्ट्रेट मधून ते बाहेर जाण्याच्या प्रोसेसमध्ये येतात आणि रिॲब्सॉर्प्शन प्रोसेसमध्ये पुन्हा ते शरीरामध्ये प्रवेश करतात. ब्लड सर्क्युलेशन मध्ये ते येतात मग ते लॉस होत नाही शरीरामधून. ती प्रोसेस झाली नॉर्मल. पण जर तुम्ही जर डायरोटिक्स जर घेतलं तर काय होतं डायरोटिक्स मध्ये ती जी रिॲब्सॉर्प्शन प्रोसेस आहे ती होते ब्लॉक. रिॲब्सॉर्प्शन प्रोसेस ब्लॉक झाली म्हणजे फिल्ट्रेट मध्ये तुमचा सोडियम फिल्ट्रेट मध्ये तुमचं वॉटर ऍज इट इज राहतं आणि ते युरिनरी ब्लॅडर मध्ये जातं. नंतर युरेथ्रा मार्फत युरिन बनवून ते एक्सक्रीट होतं म्हणजे शरीराच्या बाहेर फेकलं जातं. म्हणजे शरीराच्या बाहेर सोडियम पण गेला आणि वॉटर पण गेलं इन द फॉर्म ऑफ युरिन. Why? Because you have taken the loop diuretics which act on the loop of Henle and which inhibit the reabsorption of sodium. So because of inhibition of this reabsorption of sodium, there is significant increase in concentration of sodium. So here in DCT, because filters comes from your Bowman's capsule to PCT to loop of Henle to DCT. So here concentration of sodium get increase in filtrate. Because of that there is less water reabsorption in collecting duct. So waters and sodium get eliminated from the body. लक्षात घ्या खूप सोपं आहे. वाचल्यानंतरही तुमच्या लक्षात येईल आणि हे समजावं म्हणूनच मी तुम्हाला युरिन फॉर्मेशन प्रोसेस काय आहे हे आपण शनिवारी घेतलं होतं. काल मी त्याच्याकरताच तुम्हाला एक ॲनिमेटेड व्हिडिओ शोधून मी तुम्हाला तो पाठवला होता. तुमच्यातल्या बऱ्याच विद्यार्थ्यांनी तो बघितलेला असावा. त्यांना हे लवकर समजेल. Okay, by this way these loop diuretics are act on the loop of Henle or ascending loop of Henle. So example of loop of Henle or example of loop diuretics is furosemide and it containing the furon ring. Which ring is present in furosemide? Furon. So while drawing the structure, always you have to draw the basic heterocyclic ring present in the structure of your drug. So if you have this fashion, then you can able to remember the structure of drug. So you can draw the structure of this furosemide. Most probably I will try to make a video how to draw the structure of hydrochlorothiazide and furosemide, and I will send it on your WhatsApp group. Okay. So this is somewhat complicated structure. It is represented by CH2. Just follow my pointer. This corner is represented by CH2. So furon, CH2NH, benzene ring, sulfonamide. So in both structure, sulfonamide group is there. In both structure, sulfonamide group is there. That is, if you see the structure of hydrochlorothiazide, it is also having the sulfonamide at number 6, that is SO2NH2. Okay, and furosemide is also having the SO2NH2. So it is containing mide. So mide stands for sulfonamide, fur stands for furon, and this is the benzoic acid. Okay. So name of this compound, so numbering starts from this carbon atom because carboxylic group is most prior functional group in priority table. Then give to the number to this. Why? Because substituent is at 2 positions. Then 3, 4, 5, 6. So 3 chloro. So here is 3 chloro, 2. Now 3 bracket is there. See here, how many brackets are there? 3 brackets. Why 3 brackets? Because on 2 number, there is amino substituents. 2 amino methyl is attached and 2 methyl furan ring is attached. Okay. So that's why they are using the 3 brackets. So last terminal is what? Furan. So furan numbering is like that. 1, 2, 3, 4 and 5. So furan numbering is like that. So 1, 2, 3. That is amino, methyl and furan. So terminal is what? Furan. So write down furan. And furan ring is attached at 2 number positions. That's why it is written as 2-il. लक्षात घ्या, आपण मिथेनला मिथाइल करतो, इथेनला इथाइल करतो, तसं फ्युरॉनला काय केलं? फ्युरॉन 2-il means what? Whatever the attached to on this furan ring at number 2, then followed by methyl, followed by amino. So 3 bracket complete. So first bracket is for furan 2-il, second bracket is for methyl, and third bracket is for amino. So furan 2-il, methyl, amino, and all these attached to what? 2 number position. Then 5 sulfamyl. You can say sulfonamide or sulfamyl is one of the things which is considered as substituent. So it is written as sulfamyl benzoic acid. So C double bond O, OH is a benzoic acid. So this is the IUPAC. Name of furosemide is 3 chloro, 2 furan 2-il, methyl, amino, 5 sulfonamyl benzoic acid. So this is the popular brand name of furosemide. Lasix is the popular brand name of furosemide, which is available in injection format. Which form? Injection form, which is used as an anti-hypertensive agent. Used as a anti-hypertensive agent. It is available in a white crystalline powder, which is insoluble in water. It should be stored in a light resistance container. It is sold under the popular brand name of Lasix. बाकीचे पण खूप सारे नेम्स आहेत फ्युरोसेमाइडचे, but popular is what? Lasix is for the furosemide. It is mainly useful for the treatment of hypertensions or high blood pressures. Why the diuretics are useful in the treatment of hypertensions, or why diuretics is used as antihypertensive agents? Because if you are using the diuretics, what happens? The excess of sodium ions and water get lost through urine. As sodium ion loss through urine means the concentration of sodium in the blood circulations or in the blood get decreased. And because of that, the blood pressure is also get decreased. Sodium ion is responsible to increase the blood pressure. Sodium ion is responsible to increase the blood pressure. And if you are using the diuretics, we have seen the loop diuretics and thiazide diuretics both inhibit the reabsorption of sodium. आपण 2 डायरेटिक्स बघितले, दोघांनी काय केलं? रिअब्सॉर्प्शन स्टॉप केलं. कशाचं? सोडियमचं. म्हणजे रिअब्सॉर्प्शन स्टॉप केलं म्हणजे काय? युरिन मधून ते परत ब्लड सर्क्युलेशन मध्ये आलेलं नाही, ती प्रोसेस स्टॉप केली. म्हणजे ब्लड सर्क्युलेशन मध्ये सोडियमचं प्रमाण कसं झालं? मग कमी झालं. आणि सोडियम आयन्सचं प्रमाण कमी झाल्यामुळे ब्लड प्रेशर पण काय होतं? मग कमी होतो. जर सोडियमचं आयन जर रक्तामध्ये जर जास्त असेल तर ब्लड प्रेशर वाढतं. म्हणूनच जर आपल्या घरामध्ये, आपल्या इकडच्या तिकडच्या नातेवाईकांमध्ये जर कोणाला ब्लड प्रेशरचा जर त्रास असेल तर त्यांना डॉक्टर फिजिशियन्स काय सजेस्ट करतात, थोडं आळणी खात जा, मीठ कमी खा. का? कारण मीठ म्हणजेच काय, सोडियम क्लोराईड, आणि सोडियम क्लोराईड जर शरीरामध्ये जास्त प्रमाणात गेलं तर ब्लड प्रेशर वाढण्याची भीती निर्माण होते. म्हणून त्यांना जास्त मिठाचे पदार्थ खाण्यापासून वर्ज्य केलेलं आहे. इफ someone in your relations is having problem of blood pressure, that is high blood pressure, the physicians are always give advice to take a low salt diet. Why? Because salt containing sodium and chloride ions. If you are taken the high salt diet, that is sodium ion is get entry into your body, more amount of sodium causes the increasing blood pressure, and this leads to hypertension. So to avoid that, you have to take the low salt diet. If you are taken the diuretics, so what happens in diuretics? Diuretics inhibit the reabsorption of sodium, and because of that sodium are get excreted through urine. So ultimately it affects on the blood pressure, that is it decreases the blood pressure. Okay, we have seen the two classes, that is furosemide and hydrochlorothiazide, that is thiazide diuretics and loop diuretics. They causes the hypokalemia. Hypo means decrease, kalemia means potassium. So it also get loss of potassium. It also get loss of potassium. So because of that, these drugs are always taken with care in order to prevent the hypokalemia. Hypokalemia means what? There is decrease in concentration of potassium in body. आपल्या शरीरामध्ये जर पोटॅशियमचं प्रमाण जर कमी झालं तर त्या कंडिशनला म्हणतात हायपोकॅलेमिया. त्या कंडिशनला म्हणतात हायपोकॅलेमिया. So thiazide diuretics and loop diuretics are having side effects hypokalemia. Why? You have seen how these thiazide diuretics and loop diuretics are act. They are stop the reabsorption of sodium ions. Stop the reabsorption of sodium ions. And because of that, infiltrate, sodium ion concentration get increase in distal convoluted tubule. So because of increasing amount of sodium, it stimulates the aldosterone sensitive sodium pump. जर सोडियम आयनचं कॉन्सन्ट्रेशन डीसीटी मध्ये म्हणजे डिस्टल कॉन्व्होल्युटेड ट्यूब्यूल मध्ये जर जास्त झालं तर तो सोडियम आयन काय करतो, अल्डोस्टेरॉन रेनिन अँजिओटेन्सिन सिस्टीम्स और अल्डोस्टेरॉन सेन्सिटिव्ह सोडियम पंप स्टिम्युलेट करतो म्हणजे त्याला ऍक्टिव्हेट करतो. and because of its activations which increases the potassium and hydrogen ion excretions into the urine. If the aldosterone sensitive sodium pump gets stimulated, this leads to what? Increases the potassium and hydrogen excretion into urine. म्हणजे जर सोडियम जर जास्त झाला डीसीटी मध्ये तर तो अल्डोस्टेरॉन सेन्सिटिव्ह सोडियम पंप ऍक्टिव्हेट करतो. ह्या पंपला ऍक्टिव्हेशन झाल्यामुळे हा पंप काय करतो, ह्या पंपाच्या मार्फत पोटॅशियम आणि हायड्रोजन आयन सुद्धा काय होतात, युरिन मधून लॉस होतात. बिकॉज ऑफ एक्सेसिव्ह लॉस ऑफ पोटॅशियम फ्रॉम द बॉडी, that is condition is called as hypokalemia. That condition is called as hypokalemia. That condition is called as hypokalemia. आलं लक्षात? काय होतं, सोडियमचं रिॲब्सॉर्प्शन ब्लॉक झाल्यामुळे सोडियम आयनचं कॉन्सन्ट्रेशन डीसीटी मध्ये इन्क्रीज होतं. Because of increase in the sodium ion concentration is DCT is increased, it stimulates the aldosterone sensitive sodium pump, And because of this aldosterone sensitive sodium pump, it increases the potassium and hydrogen ion excretion into the urine. That condition is called as hypokalemia. But if you have taken one another diuretics along with the thiazides and loop diuretics, that is potassium sparing diuretics, it blocks the action of this aldosterone sensitive pump. It blocks the aldosterone sensitive pump. लक्षात घ्या. आपल्याला केमिस्ट्रीमध्ये लक्षात नाही राहिलं तरी चालेल, पण तुम्हाला माहितीसाठी, कोलॉजीच्या माहितीसाठी ही गोष्ट गरजेची आहे की थायझाइड डायरोटिक्स आणि लूप डायरोटिक्स पोटॅशियम स्पेरिंग डायरोटिक्स बरोबर कॉम्बिनेशन मध्ये का वापरतात. बिकॉज thiazides and loop diuretics causes the hypokalemia. So potassium sparing diuretics are used to stop the excretion of potassium. पोटॅशियम स्पेरिंग म्हणजे जो स्पेअर करतो पोटॅशियमला, त्याच्या नावामध्येच त्याचं मेकॅनिझम दिलेलं आहे. इट स्पियर्स द पोटॅशियम, इट प्रिव्हेंट्स द पोटॅशियम टू गेट लॉस इन टू द युरिन. जो पोटॅशियमला युरिन मध्ये लॉस होण्यापासून वाचवतो असा डायरोटिक्स म्हणजे पोटॅशियम स्पेरिंग डायरोटिक्स. म्हणजे काय? पोटॅशियम स्पेरिंग डायरोटिक्स. So we have seen the two class, it having the two class, that is aldosterone antagonist and sodium channel blockers. Aldosterone antagonist, what? It antagonizes the action of aldosterone. Antagonize means to oppose the action of aldosterone. By opposing the action of aldosterone, it will inhibit the aldosterone sensitive sodium reabsorption. It inhibit the aldosterone sensitive sodium reabsorption, and because of that there is less potassium and hydrogen ion are exchanged for sodium. जे रिॲब्सॉर्प्शन ब्लॉक झालं म्हणजे त्याच्याबरोबर पोटॅशियम आणि हायड्रोजनचं एक्सचेंज होणार नाही, आणि एक्सचेंज झालं नाही म्हणजे पोटॅशियम तुमचा ऍज इट इज ब्लड सर्क्युलेशन मध्ये राहील, म्हणजे हायपोकॅलेमिया होणार नाही. आलं लक्षात? सो इट अँटॅगोनाइज द ऍक्शन ऑफ अल्डोस्टेरॉन सिस्टीम by which it inhibit the aldosterone sensitive sodium reabsorption. Sodiums are not entered into the blood circulation, so because of that potassium is also not entered into the urine formation. So if suppose if you consider, okay, if you consider this is the two compartment, this is filtrate, okay, and this is blood circulation. So sodium ion are get reabsorbed, it exchange with potassium ions. But this aldosterone antagonist inhibit this process, okay, that is reabsorption of sodium. So through blood, potassium also not excreted or secreted into the urine formation process. So it retain, it spares in the blood circulation. That's why it is called as potassium sparing diuretics. आलं लक्षात? याला पोटॅशियम स्पेरिंग डायरोटिक्स काय म्हणतात? कारण हा ड्रग वापरल्यामुळे शरीरामधील पोटॅशियम लॉस होत नाही. का लॉस होत नाही? कारण हा अल्डोस्टेरॉन सेन्सिटिव्ह सोडियम रिअब्सॉर्प्शन इनिबिट करतो. इट इनिबिट द सोडियम रिअब्सॉर्प्शन. ॲज देअर इज इनिबिशन ऑफ सोडियम रिअब्सॉर्प्शन, देअर इज less potassium and hydrogen ion exchange. Okay, secretion of potassium and hydrogen get blocked, so hypokalemia is not produced. So it should be taken with the thiazide diuretics and the loop diuretics. Another is what? Sodium channel blockers. They directly inhibit the sodium channel, म्हणजे ते डायरेक्ट सोडियमचं ऍब्सॉर्प्शन स्टॉप करतात आणि मग त्याच्यामुळे पोटॅशियम आणि हायड्रोजनचं सिक्रेशन होत नाही. Okay, so it is used in a combination of thiazide and loop diuretics to prevent the hypokalemia produced by loop diuretics and thiazide diuretics. So in order to minimize the side effect of thiazides or loop diuretics, you have to use potassium sparing diuretics with the loop diuretics and thiazide diuretics. Okay, next example, next class is osmotic diuretics, which inhibit the reabsorption of water and sodium. See here, again it will inhibit the reabsorption water and sodium by increases the or maintaining the osmotic pressures in a blood circulations. हे ड्रग घेतल्यामुळे ब्लडमध्ये पाण्याचं प्रमाण मेंटेन राहतं, त्याच्यामुळे रिअब्सॉर्प्शन होत नाही पाण्याचं रिअब्सॉर्प्शन झालं नाही म्हणजे सोडियमचं पण होत नाही. म्हणजे तुमचा हा इकडं ब्लड कंपार्टमेंट असतो, ओके, इकडे तुमचा फिल्ट्रेट पीसीटी मध्ये डीसीटी मध्ये फिल्ट्रेट असतो. इकडे तुम्ही हा ऑस्मोटिक डायरोटिक्स घेतल्यामुळे याला जे गरजेचं आहे एक्स्ट्रा सेल्युलर फ्लुइड्स मध्ये जे आयोनिक कॉन्सन्ट्रेशन गरजेचं आहे वॉटरचं, वॉटर म्हणजे काय H2O, ते मेंटेन राहतं. बिकॉज ऑफ दॅट द रिअब्सॉर्प्शन प्रोसेस गेट ब्लॉक. बिकॉज ऑफ दॅट द रिअब्सॉर्प्शन ऑफ सोडियम and reabsorption of water get blocked. Why? Because already it containing the tonicity, already it containing the osmotic pressure in extracellular body fluids. Okay, so that's why it is called as osmotic diuretics. That's why it is called as osmotic diuretics. So you have to take it intravenously because it should be directly entered into the blood circulation. Because of presence of this osmotic diuretics in the blood circulation, automatically it will inhibit the reabsorption of water through filtrate, so it will get excreted as a urine. It will get excreted as a urine. Okay, so this is osmotic diuretics. लक्षात घ्या, ऑस्मोटिक डायरोटिक्स म्हणजे काय की जे डायरेक्ट ब्लड मध्ये इंजेक्ट केले जातात आणि त्याच्या इंजेक्शनमुळे काय होतं की ब्लड मध्ये वॉटरचं प्रमाण आणि आयन्सचं प्रमाण मेंटेन होतं. मेंटेन झाल्यामुळे तो रिअब्सॉर्प्शन प्रोसेस होऊ देत नाही आणि रिअब्सॉर्प्शन प्रोसेस ब्लॉक झाली म्हणजेच फिल्ट्रेटमध्ये जो वॉटर आणि जे सोडियम आहे ते ॲज इट इज राहतं आणि फायनली दे आर एक्सक्रिटेड ॲज युरिन. म्हणजे शरीरामधून पाणी आणि सोडियम हे जास्त प्रमाणात बाहेर फेकलं जातं, ते रिअब्सॉर्ब होत नाही की जे नॉर्मल प्रोसेसमध्ये 80% रिअब्सॉर्ब होतं ते ह्या ऑस्मोटिक डायरोटिक्समुळे ते होत नाही. ऑस्मोटिक डायरोटिक्स डज नॉट हॅव्हिंग एनी फार्माकोलॉजिकल इफेक्ट ऑन अदर पार्ट्स ऑफ द बॉडी. दुसऱ्या कुठल्याही पार्ट्सवर तो इफेक्ट दाखवत नाही. फॉर एक्झाम्पल ग्लिसरीन, आपण जर ग्लिसरीन घेतलं तर ग्लिसरीन शरीरावर कुठलाही अपायकारक इफेक्ट दाखवत नाही, युरिया पण दाखवत नाही. मॅनिटॉल, sugar type mannitol, it is one of the sugar, isn't it? It also not having any effect on our body. But if it is enters into the intravenously into the blood circulation, then it will show the osmotic effect, and because of that the reabsorption of water and reabsorption of sodium get stop, so flow of urine get increase, production of urine get increase. Example is mannitol. So this is very easy structure of mannitol. Last year you have studied the structure of glucose, just like of that. So it is a alcoholic type groups. So there are 6 carbon atoms all containing the alcohols, OH. 1, 2, 3, 4, 5, 6. All, it's very easy to draw the structure of the mannitol. 6 carbon atoms are there, and each carbon atom having the OH group, and then you have to supply the hydrogen in order to complete the 4 bond of carbon atom. So this is 1 number, and this is 6 number. Only it containing CH2, rest of containing CHOH, CHOH, CHOH. So it is very easy structure for you peoples. Now last class is the carbonic anhydrase inhibitors. It will inhibit the enzyme named as carbonic anhydrase. Enzymeचं नाव काय आहे? Carbonic anhydrase, which is found in PCT. PCT means what? Proximal convoluted tubule. Proximal convoluted tubule. Because of inhibition of carbonic anhydrase, it will prevent the reabsorption of bicarbonates from renal tubules. Renal tubules containing PCT, DCT, loop of Henle, and collecting duct. लक्षात घ्या, nephron having 2 parts, renal corpuscles and renal tubules. Renal tubules means what? It is composing of proximal convoluted tubule followed by loop of Henle followed by distal convoluted tubule followed by collecting duct. So these, by the action of this carbonic anhydrase, the bicarbonate ions get reabsorb. But by the inhibition of the enzyme activity, the reabsorption of bicarbonates, it get stopped or it get prevented. So because of that, it will result in decrease the activity of sodium hydrogen exchanger. That is, ज्याच्यामुळे ज्या पंपमुळे सोडियम आतमध्ये जातो म्हणजे ब्लड सर्क्युलेशन मध्ये परत जातो आणि ब्लड सर्क्युलेशन मधला हायड्रोजन तुमच्या फिल्ट्रेट मध्ये येतो, तो प्रोसेस स्टॉप होते किंवा लोअर होते. म्हणजे try to get the clear idea. Okay, what's clear idea? Carbonic anhydrase inhibitors inhibit the action of carbonic anhydrase enzyme in proximal convoluted tubule. Because of inhibition of this enzyme, it will prevent the reabsorption of bicarbonate. जे एन्झाईम ब्लॉक झाला म्हणून बायकार्बोनेटचं रिअब्सॉर्प्शन थांबलं. Because of reabsorption of bicarbonates is prevented, it will act on sodium hydrogen exchanger. सो याची पण ऍक्टिव्हिटी काय झाली? कमी झाली. कमी झाली म्हणजे काय? जे काही तुमचं फास्ट एक्सचेंज होतं, एक्सचेंज म्हणजे काय? तुमचं सोडियम नॉर्मल रिअब्सॉर्प्शन प्रोसेसमध्ये काय होतं? सोडियम रिअब्सॉर्ब होतो, जे सोडियम ब्लड मध्ये एंटर्ड होतो आणि ब्लड मधला हायड्रोजन तुमचा फिल्ट्रेट मध्ये येतो. हा एक्सचेंजर स्टॉप होतो. का? कारण बायकार्बोनेटचं रिअब्सॉर्प्शन स्टॉप झालं. का स्टॉप झालं? कारण कार्बोनिक अनहायड्रेज एन्झाईम इनिबिट केला. कुणी इनिबिट केला? ऍसिटाझोलामाइडने इनिबिट केला. ओके, and because of that it will causing the diuresis due to retention of sodium in renal tubules. Renal tubules मध्ये जर सोडियमचं जर रिटेन्शन जास्त झालं म्हणजे पाणी तसंच राहतं त्याच्यामध्ये. जर सोडियम रिअब्सॉर्ब झाला तर सोडियम बरोबर वॉटरचं पण रिअब्सॉर्प्शन होतं. जर सोडियमचं रिअब्सॉर्प्शन झालं नाही तर वॉटरचं रिअब्सॉर्प्शन होत नाही. लक्षात घ्या, सोडियम जाताना वॉटर घेऊन जातो आणि फिल्ट्रेटमध्ये तर वॉटर असतंच. सोडियम जर ब्लॉक झाला, रिअब्सॉर्प्शन ब्लॉक झालं म्हणजे वॉटर पण तुमचं रिअब्सॉर्ब झालं नाही, त्याच्यामुळं युरिन प्रोडक्शन इन्क्रीज झालं आणि त्या प्रोसेसला आपण म्हणतो डायुरेसिस. ओके, so carbonic anhydrase inhibitors causing the diuresis because of retention of sodium in renal tubules. So acetazolamide is a very good example of carbonic anhydrase inhibitors. It is used as a diuretics. It is useful in the treatment of glaucoma also. Glaucoma, the disease related to your eye, that is intraocular pressure get increased. Okay, so already you have know the four process: filtration, reabsorption, secretion, and excretion. So most of the diuretics are act on reabsorption process. Your thiazide diuretics acts on distal convoluted tubule. Your carbonic anhydrase emitters act on PCT, and loop diuretics acts on loops. That is loop of Henle. Already you have seen this diagram of nephron also. So uses, last point is uses, pharmaceutical uses or therapeutic uses of diuretics. It is mainly useful in the treatment of hypertensions. It is used in the treatment of all types of edema. Edema means what? It is somewhat inflammations. Why inflammation is there? Because there is abnormal retention of salt and water in extracellular parts of body. आपल्या शरीराच्या काही भागामध्ये abnormal retention, कशाचं? Salt and water. Abnormal retention means what? Increase in concentration of salt and water. That condition is called as edema. If you are taken diuretics, what can diuretics can do? Diuretics inhibit the reabsorption of sodium, that is salt, and inhibit the reabsorption of water. Inhibit the reabsorption of water. And so that's why it is useful in the treatment of edema. लक्षात घ्या, इडेमाच्या ट्रीटमेंटमध्ये डायरोटिक्स का वापरतात? कारण डायरोटिक्स वापरल्यामुळे तो शरीरामधून सॉल्ट्स आणि पाण्याचं जास्त प्रमाणात एक्सक्रिशन करतो आणि ते एक्सक्रिशन केल्यामुळे काय झालं? शरीरामध्ये सॉल्टचं प्रमाण आणि पाण्याचं प्रमाण कमी होतं थोडं. आणि इडेमामध्ये काय होतं? It is the disease associated with the abnormal retention of salt and water. Means in that particular body parts there is excess of salt and water. If you are using diuretics, that water and salt are get eliminated, or you can say excreted from the body, so it will helpful to reduce the edema. Okay, so most of the disease associated with the edema is congestive heart failure, edema of pregnancy. Okay, sometimes some pregnant women having the one of the symptoms, that is edema in legs, lower legs, or sometimes renal edema is there, or premenstrual tension is there. For that purpose you have to use diuretics.